We begin tonight with the most important part of health care reform, now on life support. Tonight, a small group of senators in the Democratic caucus are reaffirming their commitment to killing the Senate health care reform bill if it includes a public option. The most vocal among them is Senator Joe Lieberman of Connecticut, who is now repeating his threat to block any bill that includes any version of a public option. With the Senate now less than a week away from debating health care reform, Democratic Majority Leader Harry Reid now has a choice: stand firm on the public option or compromise it to get something passed. Those on the compromise side argue that we should just let the bill pass without a public option so we can get all of the good insurance reform that's in the bill. But there's a dirty little secret about this. The insurance reform is gone. In order to have insurance reform, you need two things. The first is making sure insurance companies can't turn you down for any medical reason. That's called guaranteed issue. And that's in the bill. But that's only effective if you make sure that the coverage is affordable. And that's not in the bill. As the bill is written now, the insurance companies will still be allowed to gouge their customers if they have illnesses, to charge you 2 or 3 times what your neighbor gets charged. A lot of the insurance reform in this bill is gone. The only real reform that's left is the public option. And if that's compromised away, this bill is no longer health care reform. It's just a huge gift to the health insurance industry from the very same people who bailed AIG out, the American taxpayers. Instead of ruining the bill by taking out the public option, why not just do the fair thing? If there are 4 senators who won't let us pass this bill with a public option, we have a mechanism to pass it anyway, through the budget reconciliation process. If you do that, you only need 51 votes to pass it, which exist in the Senate, instead of 60. Just a simple majority. That's how most democracies work. That's what we should have done from the beginning. And that's what Democrats ought to do right now. Joining us now is independent Senator Bernie Sanders of Vermont. He's a member of the Senate Health, Education, Labor, and Pensions Committee. Senator Sanders, thanks for joining us tonight.
Good to be with you, Howard.
It seems clear to me that if these 4 senators are to be believed, the Senate can't pass a strong public option. So I guess I'm going to first ask you, would you support the use of reconciliation to fix this?
Absolutely. That is one of the real options that we have. Look, the facts are pretty clear. The overwhelming majority of the American people want a public option. They want a choice other than a private health insurance company whose function in life is to rip them off and to make as much money as possible. The president wants it. The House of Representatives wants that. The majority of the Senate wants it. And I think it is wrong. Just a handful of conservative Democrats and all of the Republicans are stopping that. So reconciliation is certainly one opportunity and vehicle that we have.
Bernie, you said this week that you would not vote for a bill that doesn't have a strong public option. Are there other Democratic senators who would join you in voting against a bill without a real public option?
I believe that there are. And it's important that we do this, Howard, because I think you've made this point. If you do not provide competition to the private insurance companies, what is going to stop them from raising their rates outrageously and costing the federal government huge sums of money? What mechanism is in this bill for cost containment? And I don't see it, frankly. So I think we have got to remain strong for a public option, go to a reconciliation method, that's another way, or maybe scale down what we are trying to do and see if we can get 60 votes. And that would mean a significant expansion of Medicaid, a real focus on primary health care and the growth of community health centers and primary health care doctors. We can do prescription drug reform. Stop the situation where we're paying the highest prices in the world for prescription drugs, the reimportation, negotiating with the drug companies on Medicare Part D, and insurance reform as well. So maybe we can get a consensus and 60 votes for a scaled-down approach.
In terms of insurance reform specifically, the current bill still allows insurance companies to gouge their customers, charging them up to 300% more than their neighbor is charged. As you know, in Vermont, we limit that to 20% above the cheapest rate, and that really works. Is that going to be the kind of thing that could be addressed during the amendment process, and what do you know about that?
Absolutely. It is one of the things that should be addressed. It's just not fair. What you're saying is, yeah, you could prohibit pre-existing conditions, but rates can be risen substantially, and people will not be able to afford the insurance in any case. That is obviously an issue that should be dealt with. We're going to be introducing at least a dozen amendments myself, and I think many other senators will have other amendments.
So, Bernie, the Democratic caucus has 2 independent senators in it, you and Joe Lieberman. Think you can convince your fellow independent that he ought to be supporting a real public option and real health care reform?
Probably not. I think that responsibility will rest with Senator Reid and millions of Americans who want real health care reform.
Senate Republicans have vowed to launch what they call a holy war on health care reform. They have already promised to use every delaying tactic in the book, which is a very long book of Senate rules. How do you stop them from watering the bill down any further, and how can we get a real bill out after we've come so far? This is the farthest we've come in 60 years.
Well, Howard, I think it is really an outrage. After 8 years of Bush, where virtually nothing was done while health care was deteriorating in America, 7 million people lost their health insurance. Premiums almost doubled on the Bush's 8 years. They did virtually nothing. Nothing. And now that Obama and some of us are trying to do something, the best they can do is play the obstructionist role and trying to kill this bill. That's wrong. And it's really a sad day for America. They should join us for real, cost-effective, universal, comprehensive health care. And it's a sad day for our democracy where these guys are AWOL on this important issue.
If I were you on your end of this question, I might not answer it, but I'm going to ask it anyway. Give me a percentage. How optimistic are you that we're actually going to get a real health care bill with real public options through the Senate, through the House, and signed by the President?
I don't know what if it will be scaled down or what. I think something will be passed. My view is it is better to have something that is strong and good and cost-effective than a bailout to the tune of hundreds and hundreds of billions of dollars to the private insurance companies who can raise their rates at any point. So at the end of the day, do I think we'll have something? Yeah, I do. What it will be, too early to say.
Independent Senator Bernie Sanders from Vermont, thank you so much for your time.
Good to be with you, Howard.